97% cure rate, I think they said, because if only, say, 40% of the population is going to die of cancer, but you diagnose it in 100% of the population at a certain age, only 1% might be dying in that population range. But if you increase the number that you treat, and you're treating people that were otherwise would never have discovered their cancer, you will seem to have a high cure rate. 50% of people, 100% of people 50 years old and older have somewhere in their body tissue that can be diagnosed as cancer.
Right.
So if you look hard enough, you can say there's 100% cancer incidence, but
not 100% of people will die from cancer.
Only a smaller percentage die. So you can claim to have cured it if you find it in those people who never would have developed it. But when you treat the cancer increasingly as you diagnose it at an earlier age, if your treatment is killing people, then the mortality rate will increase with the diagnostic rate. And starting in 1945, the American Cancer Society publicized that you should regularly have a checkup for cancer and watch for the signs. And steadily, for 40 years after that, the cancer mortality increased. In the 2 or 3 years after the prostate-specific antigen test became available, the number of diagnoses increased radically. And since there was no change in the population, the mortality would be expected to stay the same. But since the treatment went up in proportion to the extreme increase in diagnosis, also the mortality suddenly surged up, strongly implying that it was the treatment they were dying of. And when you look at the people going to the hospitals, a certain proportion of those historically in the United States, between 200 and 440,000 are being killed by medical mistakes in the hospital.